Good afternoon, everyone. Welcome back to my YouTube video channel, Day-to-Day Dentist Activity Dentist Dental Care for Patients. Here is a video regarding to a deep cleaning case. Patient came to the office. She want to get braces. As you can see, her teeth really crowded. There's a lot of teeth in her mouth. There's not a lot of room for those teeth to grow properly. So this is the reason why there's a lot of tartar buildup along her back side of her tongue side of her teeth. There's a lot of calculus and plaque. It's been for years. It's been for years that she's interested in getting braces, but she doesn't know what to do. So the first consultation we did in the quick exam, we told her that she needs a deep cleaning first. We need to maintain her gum in the best level that it can be to the normal level of a normal person before we do braces. So one of the reasons people need braces and or need deep cleaning is because when you have too many teeth, your teeth so crowded, so crooked, and every time you eat any carbohydrate like bread, rice, noodle, pizza, those stuff really easy to stuck in between those crowded teeth, and over months it turns into calculus, hard material where the bacteria can stay in those locations and cause gum inflammation, the gum infection. In the long run, if you don't do anything like that, and you end up having periodontal disease, which means the tooth get either very loose, one tooth at a time, or eventually long enough, all of your teeth really come loose and it can come out by itself. So that's called a severe advanced gum disease. We don't want to get to that stage. So the first thing we have to do for a patient who like this is 25 years old, what you have to do is just trying to eliminate all the infection of the gum and get the gum back on track. And then we figure out, once we give her good instruction how to manage the gum really well, then we can start talking about braces. But then at this point, we're trying to give her an understanding why gum and need to be healthy in order for us to do braces. So anyway, when you have too many teeth crowding, it will cause plaque accumulation, and if you haven't had a cleaning for years, you need deep cleaning. Deep cleaning helps your gum to stay, remove those plaque and inflammation gum. And then when you get the instruction, home care instruction at home, you can do a better job with cleaning yourself. Then you can get your gum healthy within a month. So first day of the deep cleaning, you don't feel very comfortable because sore, bleeding a lot. This is normal. Don't have to be worried about it because we expect it. You have years of plaque and infection gum. So when we clean it, your body needs some time to recover it. So expect some kind of salty taste in your mouth because that's blood coming out, and so the blood have a salt in there, so it tastes like salt. So rinse your mouth and salt warm water, get your gum stay more healthier. Use some Listerine. The dentist may prescribe chlorhexidine, which is a little strong chemical that reduce the number of bacteria in your mouth, and it's called bactericidal effect. It will cause reduce gum inflammation for you, reduce number of gum bacteria. So this is just a quick video, deep cleaning, guys. Thank you for watching. I hope you enjoy a quick video how the deep cleaning, during the deep cleaning, look like very bloody. But anyway, if you have any question, I have the other video talking about the consequence of no deep cleaning will end up having diabetes, risk of diabetes association with gum disease, risk of cardiovascular disease such as stroke, heart attack, and endocarditis. All of that things related to bacteria inside your gum, bacteria inside your mouth. So our body is connected from head to toes. Every part of your body is linked together in one unique body. So when you take care of your gum healthy, you actually reduce the risk for your overall health as well. Anyway, enjoy the rest of your day. Have a great day. Bye-bye.